Doctors of Reddit, what patient made you go how the duck are you even alive? I work in trauma and once had a guy fall off a roof. He said he remembered hitting the bars on the scaffolding on the way down. We originally thought he'd fractured his femur, but nope, just a small hematoma. He was in bed next to a man who had broken his ribs and had a small C-spine fracture when he fell forward picking up his keys. During residency, my IQ patient had to have his chest reopened less than an hour after 6-hour open heart CABG surgery. He needed 12 units of blood, his heart massage then shocked 4 times. Cardiothoracic surgeon and the IQ operating, because no time to go back down to or, was an illicit drug abuser and alcoholic. Nurses called him the cockroach. I checked in on him for 4 weeks. He was unresponsive every day. On week 20 we had to consult Ent to take maggots out of his nose. I was sure he was a goner after that. Week 3 passed, no change. Week 4, day 24 I believe, at 6 AM, he opens his eyes. I was shocked. He has a permanent tracheostomy now, but somehow is alive. A friend of mine had to get his entire leg amputated because he slipped off the bottom step of a ladder and bent his knee backwards. It apparently pinched some type of main blood vessel as his entire leg eventually got necrosis. When they had him in the hospital, they tried to helicopter him to some other hospital, but there were high winds, so they had him sitting there with the necrosis spreading over a stupid 1-foot slip. A guy I took care of during my residency, ducking Cyborg. I was the chief on trauma. Got a page about a patient en route with a stab wound to the chest. When the patient rolled into the trauma bay, he had no pulse. He had been stabbed in his left upper chest, 3 centimeters below clavicle. He got an thoracotomy. If you want to feel like a badass, then do an thoracotomy. We were able to cross clamp his aorta. We took him right to the OR. We oversewed one small artery below his rib, then transported him to the ICU still intubated. 8 hours later he was extubated and wanting breakfast. Seriously, dude? He was dead 10 hours before. He was also a complete asshole. No wonder someone stabbed him. My mom's a doctor. I asked her about this when it came up on Reddit. When my mom was in her IQ cycle during internship, man with police officers behind him came in the IQ. The man was perfectly fine and walking, so my mom and her colleagues were confused. The officers showed them a picture of a crumpled metal piece, which was a car. It didn't look like a car at all, just metal trash. The officers told my mom and her colleagues that they rescued the patient from the car, which was lit on fire only a few seconds after they rescued him. The patient didn't have a single scar on him, was perfectly fine, and got his name around the hospital for being immortal. My dad is 87. He had prostate, liver, bowel, colon, and skin cancer. For the skin cancer he had lots of reconstructive surgeries. His whole tibia region and the back of his hands. Every year he has to have at least one skin lesion removed. He had a couple of heart attacks and then a sextuple bypass surgery. He also had a big pneumonia, a huge abscess and a small stroke. His doctor wants to see him every 6 months. I think just to be amazed that he's still walking around. Obligatory not a doctor, but my daddy's, and he liked to tell us about the crazy shit he saw. This post made me think of one of those in particular. Huge guy, Linebacker build, came into the trauma ward with a gunshot, wound dead center of the chest. He could breathe fine, and he had a pulse. So they did a chest X-ray, and found that the bullet had spent all its energy getting through this guy's sternum, and was just resting on his pericardium. Patient here. When I was 2 I was being treated for asthma due to wheezing, labored breathing, etc. One night it got exceptionally bad, so my mom took me to the ER. They put me face down to do a CORD scan. This was 1990, and when they were done, they turned me back over, and I was blue, had stopped breathing. CORD revealed a volleyball-size mass in my chest. Emergency surgery revealed the mass was what would have been my twin. It kept growing inside my ribcage and finally had nowhere to go in my toddler body, so it cut off my airway. It had fingernails, hair, appendages, everything but major organs. Made a full recovery. Healthy 31-year-old now. Zero asthma. Only remnant of that night is a scar that goes from the center of my chest to the center of my back. As a med student on my emergency rotation, I had a guy brought in who had fallen off a 7th or 8th floor balcony and landed on his head, essentially door, and we couldn't get a blood pressure when he got to the hospital. As a student, my job was to basically stand to the side and squeeze the bajillion bags of blood that went into this dude. His cervical spine was essentially dust on the initial CORD scan we got. I figured he probably wouldn't have made it, but about a month later I'm now on my IQ rotation and I see this guy awake and conscious. Pretty crazy. Thanks for watching, like and subscribe for more Reddit goodness.